So let's go ahead. Let me introduce myself. I'm Dr. Haleema Yezdani. I'm a general physician and diabetologist from India. I'm the vice president of HIMSS India and into telemedicine from around 10 years. So I am the vice president of HIMSS India, and I also kind of see digital health in the future in India. It has a very, very bright future of late. And I basically believe in telehealth, telemedicine, AI, and digital health. All these hand in hand would make a great difference, especially in a country like ours, wherein the accessibility is a question, connectivity is a problem, and we have a huge population to cater to, and the resources could not be the same. So without much ado, let me go ahead with what I'm going to talk today. All right, so let us start with the right. So overview of today's presentation. Basically, this is about women health and telemedicine and remote health monitoring and what kind of role all these have in a combination on women health. Before we go ahead much in depth about telehealth and about women health, let us define properly what is telehealth, what is telemedicine, what is remote health monitoring, what are the aspects of women health which basically can or will be benefited by telemedicine and remote health monitoring, the interface between the two, how to connect that, and a conclusion on the same. As everyone knows, nowadays, the acceptance of telemedicine and telehealth, though it is on the brim, people are definitely using it, but still there is some kind of a, I would say, hesitancy, some kind of a reluctant to get forward to, accepting it wholeheartedly that it actually works in the field of medicine. There is issue both the sides, doctors as well as the patients. When doctors side, yes, the fraternity is opening up now. I'm very happy my colleagues are accepting most of the AI tools and learning to use them and going ahead with them. But then coming to a group of, I would say a sector of people who basically say that yes, it's very, very conventional and important that the patient is examined by a doctor in his clinic and in his or her clinic with a proper physical examination to go through. Having said all of that, I again believe education is the key tool for getting all the things in a proper place, and telehealth and telemedicine will go a long way again. Let's define telehealth. Telehealth is a broad perspective compared to telemedicine, and this defines the use of electronic data and communication technologies for healthcare and health related issues. Most includes the storing of data in the form of EMR, EHR, and stored images. They could be used in providing patient education, which is very, very important. So, at this point, again, at this time, I want to highlight a point again that patient education is very important in regards to telehealth and telemedicine and the use of it. As I talk about this, there are people who are on the other side who still might think, of course, we do have a broader audience now who knows about telemedicine and telehealth and definitely welcome it and use it. But there are people and there are patients who definitely believe that the touch and feel of a doctor is very important, and unless they do that, they will not come to proper diagnosis. Whereas it is much easier to go through telemedicine and digital health to see a doctor or to consider a doctor for primary health care and early secondary health care and preventive health care. This is definitely the go-to tool now, and people will have to be educated for that. And for education, telehealth is definitely another medium where doctors and patients can be brought under one roof to educate about the perspective of telemedicine. So again, telemedicine, the broader outlook being telehealth, the narrower one would be the telemedicine sector. WHO definition for telemedicine states that the delivery of healthcare services where distance is a factor by all healthcare professionals using information and communication technologies for one, exchange of valid information for diagnosis, treatment, and prevention of health diseases and injuries; two, research and evaluation; three, for continuous medical education of all the providers, all in the interest of advancing the health of individuals and their communities. Again, when I say individuals and their communities, this is a wider perspective for India, because if I'm talking about the sector which will benefited by telemedicine, it is definitely the rural part of India where the accessibility to proper healthcare, to good quality primary healthcare is very minimal. I would not say it is not there, it is definitely there. We do have kind of PSC primary healthcare services over there, wherein doctors are present in the OPD and they examine the patients and all that, but the people that they have to cater to are huge compared to the doctors that are available in the sector. So it makes a lot of difference if the doctor from the urban care who's already practicing out there, who already is have their own clinics or have their own setup and a big name in the health in the field of healthcare, If they can lend a few hours to help the rural people for proper primary health care, telemedicine can be an interface or a medium between the two to facilitate the consultation. It will not be time consuming, no one will have to travel, and that makes a huge difference in a country like ours. Let us again brush the telehealth taxonomy. Telehealth, as I told you, is a broader perspective, includes teleeducation, telemedicine, and teletherapy. By teletherapy, I mean psychotherapy and of course counseling. Telemedicine there are three parts of telemedicine, or in fact four parts. One is a live video conferencing, wherein I'm doing the same with the education perspective. It can be for a consultation as well. Sorry, I'm down with the cold. Second is remote health monitoring, which basically is used for chronic ailments like diabetes, hypertension, cardiac ailments, and all that. And it's also used nowadays for remission of diabetes, which is very, very new concept, and definitely it is happening. People are getting into remission even when they are on huge medicines for diabetes. The medicine usage is getting less, and people are going into non-diabetic stage thanks to remote patient monitoring and the use of it, and the use of AI, of course. And then store and forward, where the images are stored and forwarded to the doctor at a later date. There's another fourth perspective, which is called mobile health. Mobile health, of course, all of us are very familiar nowadays. We have Apple Watches, we have every possible gadgets around us to, kind of inspect us as we are talking, as we are walking. They record our vital signs. They give us a perspective of our health, and definitely tell us to they also motivate us to go ahead for having a healthy lifestyle. That could be taken care of, like aspected as a mobile health sector of telemedicine. Next is the difference. Again, as I told you, telehealth is a wider perspective. It involves education, it involves the formation of the EMR, the EHR, the dashboards, and includes the training of the medical professional and everything, including telemedicine. Telemedicine is a part of telehealth, but not vice versa, right? Sorry. Telemedicine, in fact, is basically the conferencing that we are doing. It's the practice of delivering medicine and healthcare when distance is a concern, specifically to remote areas, especially for clinical services, using telecommunication infrastructure to deliver the same. So this is the difference between telehealth and telemedicine. This is a very, very important perspective which we have to know before going ahead or practicing telemedicine in anything. Next thing is, what is remote health monitoring? It's the ability to monitor patients outside the conventional clinic settings or hospital settings. Usually, patients are called to the hospital for any kind of monitoring, even for examination. In remote monitoring, they can sit at home, they can be in the plane, they can basically be anywhere in the world, but be monitored by a proper doctor in the setting of his own comfortable zone. It also helps to collect and analyze the data on a variety of health issues and prevent early detection and prevent the clinical deterioration. So, for example, if I'm sitting here talking to you, if I wear an Apple Watch now and my heart rate maybe could kind of go very, very high, this will send a signal to my doctor or signal to a person who will be monitoring me that the heart rate is high. Of course, I would be having to answer a question later on that yes, I am in a meeting, maybe I'm talking, maybe there's an artifact and everything. But then it's better to err the other side than to wait. The signals are caught early, clinical deterioration is prevented, and early treatment is possible, especially in management of ailments like diabetes, hypertension, as I told you, and chronic heart diseases. This is how remote monitoring is done. So there is a person who was on his morning walk, has gadgets everywhere. He has his watch, he has his ambulatory monitoring for his blood pressure. Everything is being monitored and taken care of in the center or in the ambulance or by the doctor who is taking care of him in his mobile, wherever the doctor is present. And here are the signals which beep through, and they are passed on to the healthcare provider. So definitely a very, very important aspect, and very, very essential for chronic monitoring, chronic care, as well as to prevent any kind of acute deterioration of the patient. Okay, nowadays the new thing is sound technology. Sound can detect over 100 diseases. There can be different sound frequency which can detect different parts of body, ailments in different part of the body, in the throat, in the lungs, in the heart, bowels, and of course even the fetal heart rate can be found out through sound technology, which is the latest development in AI. Coming to women health, of course, I think most of us here, the top 100 ladies, and many more who are watching us talk live here, agree that a lady's life is always like a race between the family and the career. So we definitely have to make it at both the ends. Typically, the last area of women focus is their own health. Unfortunately, that is the most important aspect of a person. When everyone is focusing on their health in the family, the lady ends up being the last one to take care of her health. Why? Time constraints. They are a major barrier when it comes to multitasking, especially what that we do at every possible level. Hence, we always say our health takes the back seat. We take care of our fathers, we take care of our brothers, our husbands, and our children. When it comes to us, time is always a constraint. We don't have enough time to take care of us. What if both can be done simultaneously? You can do your task as well as take care of your health. How does AI and remote health monitoring help you do the same? It can be again divided to broader perspective. The women health, especially, can be two major criterias. One is physiological issue and pathological issue. Believe it or not, of course, I mean, all of us, like it or not, we have problems both in physiological cycle as well as in pathological problems, right? So both need attention and time. We can't just say this is a normal aspect of life for most of our problems and brush through. Unfortunately, we deal with most important physiological problems which are a part of our life cycle, and have to deal with it at the simultaneous the same time as managing our family and our jobs. So during this time, telemedicine comes to the aid. Telehealth and remote health monitoring definitely can help you run a long way. What are the physiological issues? Attaining menarche has its own problem. After attaining menarche, every month we have an issue with the menstrual cycle. Gestation, again a physiological thing, but has major issues. Menopause. So all these cycles of a woman's life, every cycle of a woman's life at this perspective has its own problems coming up through it, isn't it? So at the same time, what can we do? At menarche, we are at school or we are at college concentrating on our studies. We can't miss the classes. Plus, we have to take care of our parents at home. So we can't wait for our kind of acne to go away, or we can't wait for things to happen to proceed further. So telehealth, telemedicine, and these things definitely make life more easier. Pathological issues like cardiovascular problems, though it's more common in males, breast cancer, cervical cancer, which definitely, as I can't stress these two enough, osteoporosis and depression. Clinical depression stays with us, a part of us during physiological as well as pathological issues. Then, why is women health so important and so spoken about? So, as everyone says, educated woman educates the whole family, in turn, the whole society. So, if the lady has a health concern, it is not limited to her alone. It goes to the whole family. The entire family bears the brunt of it, and in turn, the entire society is affected. So, we have to find a midway between her life and her health. The only bridge I can think of here is telehealth and digital health, which can support her remotely. It's about time that a lady takes control of her own health, and what better medium for that than telehealth and remote monitoring? Through this, she knows what is happening to her, she knows when and what she can anticipate, and how to take care of it. So, let's go through each aspect of women health and how telemedicine is proven to be a boon in managing each aspect of her life one by one. Physiological issues. What are the most commonly encountered issues during menarche? So, telehealth can help early education of ladies or girls to avoid confusion during attaining menarche. Of course, all of us would say that there is Google, there's a lot of data on the net which can basically help this information. We don't have to go through education and remote monitoring. Telehealth for this, but a proper tailored data from a professional makes a huge difference as compared to the data which basically is out of the nowhere and can't have proper claim for the same. Then development of acne, this can be prevented by having a telemedicine consultation by a qualified dermatologist while she is in her school. She can schedule a call during her lunch break or her off time, take a consultation, start her medicines, and move on in life. The next aspect is menstruation. What is menstruation? It's a natural preparation of the uterus for pregnancy. The problems encountered during this phenomena can be plenty. There can be dysmenorrhea, that's painful periods. There can be menorrhagia, excessive bleeding. There can be polymenorrhea, that's frequent cycles. There can be amenorrhea, that is skipped cycle, right? So all these are important perspectives of during a woman's menstruation cycle. Dysmenorrhea, an early telemedicine consultation during the first few days can ease the painful cramp that are felt during this time, and she can move on with her life or go ahead with whatever she's doing. Menorrhagia, excessive flow, education can be given to the lady that this can be anticipated and what best she can do to prevent that. how she can use water as a source to prevent dehydration, how she can hydrate herself, and what kind of stuff she should be eating and what she should not be taking. Amenorrhea, again, the reason for amenorrhea can be investigated and triaged for during the amenorrhea days. Premenstrual symptoms, most of us face depression, there is anxiety, there is more to it. So with all these in place, excellent doctor being on you, with you through the call, being monitoring, you're being monitored remotely by a proper doctor who can guide you throughout your cycle and throughout the problems that you're facing during and after the cycle. Again, women health, that is fertility aspect. There are AI based app now, fertility trackers. I'm sure all of us are aware of that. Once you feed the data of your cycle into it, the output of the fertile days and the safe period gives you an idea when, if you're planning to conceive or you're planning for any kind of family planning or not to conceive. So the safe period and the fertile period both are known to you once data is fed into the device. So AI based fertility tracker, this is a boon for people or ladies who are finding difficulty in conceiving. You can see an example here. Most of us know this, but then just a brush up. Tracking the period, the days of ovulation, which is the best day for ovulating, or they might consider ovulation may happen. There are kits like pregnancy kits to track ovulation. Again, following that, they can even track the pregnancy. Know the fertile days with the highest chance of getting pregnant. Then the conception guidelines based on the basal body temperature as well as cervical mucus, which can be analyzed by the AI with a small sample from you, and that can be basically totally monitored on your mobile phone. You can know when you are having LH peak, when you are going to ovulate, and what kind of a cervical mucus that you could be having now that can help you assist your fertility, right? So once we are through fertility, the next thing is conception or pregnancy, right? Telehealth, telemedicine, and remote monitoring, all these three hand in hand help ladies manage the issues during pregnancy and postpartum period. All of us again agree with me that this is a very important part of a lady's life, wherein all the 9 months and the 3 weeks postpartum are a crucial period in especially for our health, right? A pregnancy tracker, for example, if a lady is enrolled in a pregnancy tracker, this will help her remind about her antenatal health checkup which she has to go. And this will also help her to consult her gynec in between through teleconsultation if she has any issues. First time mothers always have a lot of anxiety. They would be having a lot of questions and would not wait for their appointments to show up than to relax themselves with a telemedicine consultation in between. Starting from the conception throughout the 9 months, especially in the first pregnancy, it really proves to be a boon. The lady is unaware what she should anticipate and what she should do, especially during this particular the first 3 months of the pregnancy in the first trimester. During this time, telemedicine and teleconsultation definitely plays a huge role. Next, talking about the pregnancy, as I told you, it goes on through the trackers. Each semester has a tracking. So I'm talking about, when I'm talking about this, there's a device which basically helps to monitor the fetal heart rate. The lady doesn't have to come out of her house. She can very well stay at her house. I'm sorry, I'm unable to play the clip. This particular device records the fetal heart sounds, and this can be transmitted to the doctor who is available or who is taking care of her. I think the time is less. I'll just wrap up quickly. Menopause is also very important for supplements and consultations. Pathological issues like breast cancer is, I will have to make this jiffy, but this is the most important thing. Right? AI based applications, they facilitated the self examination and mammogram. Mammogram definitely gives a confirmative diagnosis, but self examination and AI based tools which help to kind of get you the idea that you could be having a lump out there which needs investigations, these things go a long way. A remote device which is as small as an ultrasound machine or maybe as small as a hair removal machine which can be carried with you throughout, this helps to detect the breast cancer at the early stage. You can see the images here. The first one is normal breast tissue, abnormality type 1A, where lesion is found. So 1B, the lesion is kind of increasing, and 1C, what are the other perspective to the skin which is happening out here. So all these kind of kind of perspective is very essential for malignancy, early detection, and treatment. So with this, the lady doesn't have to step out to the clinic. She doesn't have to go to the hospital to do a mammogram. Though mammogram is a confirmatory thing, again I repeat that. But before that, if she feels that there is a lump, she doesn't have to panic. She doesn't have to sit and cry or wait for the next appointment for mammogram. Get the device and monitor yourself at home, and be rest assured if it is negative. If positive, again, you have to confirm through a mammogram. Cervical cancer, the second most important thing. Again, there are devices through smartphones and colonoscopic devices, colposcopic devices through which you can detect early cervical precancer and cancer. The colposcopic device here, you can see the cervical tissue. It's very, very easy to detect. Of course, all these devices can't be used at home, but you can definitely get the report immediately. You can see the film out here, and the doctor can tell you, don't have to wait for the biopsy as well. The doctor can give you an idea whether it's malignant or not. Confirmatory, again, will be the biopsy itself and the pap smear. In depression, mini mental examination, which is remote, again, plays a vital role. Again, thank you very much for the patient listening. We ladies have to take care of ourselves and keep our health in our hands. Thank you so much.